Welcome to the Green Wisdom Health Podcast with Dr. Stephen and Janet Lewis, where you will learn about natural solutions to common ailments. And now, here are your hosts, Dr. Stephen and Janet Lewis.
Hello and welcome to this week's edition of the Green Wisdom Health Show. I'm Janet Lewis.
And I'm Dr. Lewis.
And today we are going to discuss a topic you guys keep asking us about that we keep trying to dance around. So we're going to keep dancing, but we're going to give you our best shot at explaining what we do and what's going on. Now that we have your curiosity up, you're wondering what it is. I know. But we entitled...
can't tell you.
Yeah, we can't tell you. We have to just kind of talk in code. The name of the show is called Treating Long... I'm sorry, it's not treating. We're supporting long haul syndrome. So we do not treat that. We just give you things that might help you get over long-term chronic sickness. And you'll just have to fill in the blank on what that is. But, you know, many things can help with that sort of thing. And we also have a symptom list of you figuring out if you have these long haul symptoms or the syndrome.
Chronic immune system depletion.
There you go. So we're going to tell you the things that we do, the things we recommend, because, you know, we're getting another round of people getting sick, and we want to make sure you stay healthy, especially going into this fall. You know, we've got Saharan dust attacking us now, and people have a bunch of allergies, and then you have this virus stuff that just seems to be on the loose. So, Dr. Lewis, I think you should go ahead and explain what we're doing.
You know, before we started this, we asked God to help organize my mind. You know, if you've listened to me before, organization in my mind is pretty much non-existent. I'm way off the charts today. I've got too much to say and not enough time to get there. So, you know, what we're talking about is helping your body boost immune system. I'm a chiropractor, so I always approach it from a musculoskeletal sense. But if you support musculoskeletal, you're supporting all the cells, which are supporting your immune system. So we'll get into that. I wanted to talk about mushrooms, and then Janet kind of changed that. I'm going to talk about mushrooms anyway.
Maybe he's wanting to smoke mushrooms. I'm not sure which one, but we're using them for immune system.
Yeah, and you know, I do not treat cancer. God knows you need a hematologist that understands natural stuff too. But, you know, when Janet first said we talk about mushrooms and then she changed her mind, she never changes her mind about me, but everything else maybe. You know, there's a lot of cancer books, and again, I don't treat cancer, of course, but mushroom extracts are used. Sometimes it's mataki, sometimes shiitake, a turkey tail, lion's mane. And the beta glucans that you can get from that. And this is in some of the books that talk about how some people, natural doctors, treat cancer. And that's certainly not the only thing you should be doing if you have cancer, but other things that are anti-proliferative, which means they kind of help keep the cancer. And if it works for cancer, it's going to work for immune system. And you people that have chronic fatigue, some of the anti-proliferative agents are selenium, fish oil, garlic, cat's claw, mataki, diffraction, vitamin E, vitamin K, quercetin, and bovine cartilage, which actually we've improved. Our collagen has just come in again, thank you. But that all may assist the cancer patient in this manner. There's also a lot of studies that said these nutrition supplements do not interfere with chemo, and there's a lot of, I know, controversy, and sometimes lies are told so much that people actually start to believe it, which gets into one other lie, and I want you to think about it. There's this big long lie that's been going around for years that says cancer can't live in an alkaline environment. Folks, you know what BS stands for? Belief systems. There's plenty of research, and I'm saying this because if this is true of this, therefore it's true in your chronic fatigue, long haul symptoms. The optimal pH medium for growth, the optimal pH for staph is 7.4. That's alkaline. Streptococcus, pneumococcus, diphtheria, tetanus, influenza, gonococcus, meningococcus, brucella, abortus, and H. pylori. All of those prefer an alkaline environment, and people are doing their dead level best to get alkaline. You know, God has alkaline acid buffers in the body. You need to quit trying to manipulate that. A good healthy flora, which means the microbiome, the good bacteria, needs and loves acid. Pathogens love and need alkalinity. And then there's a study it's a very good study. I read it. It says cancer thrives in an alkaline environment. Well, you get on the internet, it'll tell you the opposite. Quit believing everything you read on the internet. You know, I've told people, I said, Satan just uses that to control you, manipulate you, put fear and doubt in there. And people look at me, it's like, well, whether you believe in Satan or not, I don't know. There's negative entities, so.
Well, it ain't even that. It's you're seeing what they want you to see, too. So you don't get the whole picture of other truths that could be out there that doesn't fit into what they would like you to know. So
yeah.
you only get to hear what they want you to hear. So don't believe everything you read, because, I mean, maybe that is a one-sided deal, but there's also a bunch of other opinions that don't ever get published or get taken down because they don't like the research.
Yeah, and you know what everybody should do, in my opinion, is go get a good picture of the food pyramid and then eat exactly the opposite of how it says, because on the base of the pyramid it says 6 to 11 servings of bread, cereal, rice, pasta, and usually there's a massive amount of wheat in there, and wheat and H. pylori go together. Yes, it does. People say, oh, I have GERD or acid reflux. I said, well, it's wheat or H. pylori or lack of stomach acid, which goes back to the lack of stomach acid would be alkalinity. So, folks, just because it's been promoted for 75 years, you don't have to believe it. And I had a call the other day. The lady says, well, my MD tested my B12, and it was 1,300 something, and it was so high that I got off your methyl B12. Folks, a bad B12 cyanocobalamin can cause and will cause your lab to go high on your B12 test. It doesn't mean it's being absorbed, and it has to be in large amounts for your body, especially this lady's age. For your body has to have a lot in order for it to be available to be absorbed. So be careful who you listen to, and even when I sit down somebody here locally or on Zoom or phone calls, I say, listen with a discerning spirit. Use your intuition, even when I'm speaking. You need to always listen to that. So, on and on. Again, I've got about 3-4 hours worth of notes, and we're going to try to cram most of it in 30 minutes.
So there is some common symptoms of long haul syndrome. They are fatigue, shortness of breath, or difficulty breathing. And we're just telling you we're going over all this because we have many people walking into our store now that are emailing us. Some are on Shooting Straight with Dr. Lewis on Facebook. They're all asking, what can we do? What can we do? We felt like it's our job to try to help you through it, because I guess it isn't going anywhere for a while. And you need to be strong enough so whenever these other illnesses come along, that you can withstand some of this and not be brought down. So if you don't know what some of the symptoms of it are, there's a chronic cough, joint pain, chest pain, memory. Lots of people say they've got tons of brain fog, concentration or sleep problems, muscle pains or headaches. They have a fast or pounding heartbeat. They have lost their smell or taste, and I mean for many months. Depression or anxiety, fever, dizziness when you stand, and you're worse after physical or mental activities. And they result, if you keep these things and you don't do anything to try to help it, the result of the damage is the following to these body systems. Your pulmonary and lungs will be permanently injured, your immune allergy response, your mitochondria energy system, your heart, and your central peripheral nervous system. So, Dr. Lewis, I'd like maybe you could discuss some things that someone could take to help maintain or get better from any of those things. You know, tell us what mitochondria energy is? I mean, what are you trying to achieve with these products?
Well, the mitochondria, and each cell has a lot of them in there, and it's like the spark plug that ignites the gasoline vapor, or which releases the energy. So mitochondria are the powerhouses, and there's a lot of different facets to good health. It can be community purpose. We've talked about doing good for others. Diet, nutrition, and their signals, the macronutrients, micronutrients, total energy, glycemic impact, hygiene and habit signals, environmental signals. We've talked about the toxins and chronicity, whether it's long-term shift workers, seasonal, regular rest, vacation, sleeping time, stress response signals, and we do a lot of that with your cortisol. Some of the things you just have to throw it in and let God sort it out. And I'm sorry that people that are trying to get you healthy are more and more being silenced. And I work with the medical profession. You know, I tell people, get lab. And a guy came in, he had a horrible lab. I'm not an MD, I can't judge this, but I knew he was within a week or two or very close to death. And I said, well, you need to go to your MD because of this, and this. He said, I've been to several of them, including the VA, and they won't pay attention to me. I said, my supplements are not going to help you. It's too little, too late. There are limitations to time, and there's limitations to matter. And, of course, he called me back after his medical doctors paid attention to him. He says, you saved my life, because he had some stuff going on. So the first thing you should do is get lab.
Yeah, and I wanted to get there too, because there's an important test on there that we run now, but I wanted to talk a little bit more about the supplements you're using and why. You know, a lot of people already know about vitamin D. You've heard about vitamin D. You've heard about zinc. A lot of them are taking that, but you know, zinc, vitamin C, because it calms down inflammation. The D is prevention, and it helps the long haul symptoms. But there's a few other ones that people have not heard of. The mushrooms are one, like you spoke about, which is the immune essentials we have, especially for people who have weak lungs. I take that every day because I know I'd be dead without it.
Yeah, cordyceps is absolutely incredible. And there's several others in there, like turkey tail, reishi, mataki, and shiitake, like I talked about earlier.
But there's things like glutathione and N-acetylcysteine, or NAC, that I know people don't really hear much about, that maybe you could tell us why that's necessary, and if you have something that has that in it, or is that like is that something you do daily, or is that just when you're sick, or what do you do?
Some people do it just when they need to. I'm more like, I don't dip my toe in the water. I dive in and I try to live life 110%. Immunocomplete is really, really, really popular. It's got some good vitamin C, D, zinc, and people say, but zinc displaces copper. Not if it's a TRACS zinc, TRAACS, the real amino acid chelate system. So it goes through a different pathway. It does not displace copper. And it has N-acetylcysteine and the quercetin dihydrate. One of the things, you know, if you want to get simple, multi-element buffered C. And it's got, you know, the C, and it's got some minerals to buffer it, but it has zinc, copper, manganese, potassium, quercetin, and glutathione. So
explain why that one is, because it says multi-element buffered C. You know, people will go, I'll buy vitamin C much cheaper than that at the drugstore. What makes that different as a product? Because it is kind of expensive. But what's in it?
It's 3 to 6 months worth, depending on how you take it, whether you take 2 a day or 4. Well, one of the things, calcium, we don't talk about calcium a lot because usually you can get enough out of your diet. But did you know calcium lowers cholesterol and helps prevent cardiovascular disease? And that, along with the pulmonary issues, or you know, some of the things that are going on, has to do with muscle growth and contraction, can or may lower blood pressure, although I push magnesium more for that. But lowered calcium or calcium deficiency can cause brittle nails, eczema, elevated blood cholesterol, insomnia, muscle cramps, nervousness, numbness in the arms, da-da-da-da-da. But now, one thing you've got to realize, you've got to have stomach acid to assimilate calcium.
Now, is this in the multi-element buffered C?
Yeah.
Okay.
And some of the other things, I like to talk about copper because you don't hear much about it. Lack of copper, and I've seen this a few times, but copper has, if you have a deficiency, you can have dysfunction in hemoglobin and red blood cell formation. It works to balance with zinc and vitamin C to form elastin. And this is not the most important thing about elastin, but ladies, that means if you have all that, you'll have fewer wrinkles. And it's important. Well, it's skin protein, healing process, energy, hair and skin coloring, taste sensitivity. It doesn't mean you won't get gray, but I'm getting gray very, very slowly. I just have my driver's license
Go right ahead.
renewed, and Janet put brown gray on the form. And
Hey, I couldn't decide. I couldn't decide if it was brown or gray, so I picked both. And the lady said we couldn't pick both.
You got to pick one. I said, well, honey, you pick it. She says brown. I said, I love you.
Yeah, so everybody's hearing that now.
Copper is essential for the formation of collagen, and once again, the really good, holy geez, the best in the world collagen is back in stock. You don't want to take too much, though.
Without taking out anything from it. That was the main thing. That's why it was out of stock so long, is because they did not want to change the formula because it worked.
And we had Casey explaining that. It has magnesium, and you hear me talk a lot about magnesium, so I'll try to be quick, but it's a catalyst in enzyme activity. You've heard us say 300 different enzymes. I've read as many as 600. And it's the enzymes involved in energy production, assist in calcium and potassium uptake. So it's like, holy cow, important. But it has manganese in it. You don't hear much about manganese, and it's needed for utilization of B1. B1 is the one that'll stop brain fog almost all the time because you have too much yeast in your guts. It helps in the utilization of vitamin E, and it has to be a good vitamin E, not the regular DL alpha tocopherol. That's not a good one. And manganese has to do with overall feeling of well-being. Oh my God, people sat up and paid attention on that one. A lack of manganese can cause high cholesterol, hypertension, irritability. So if your spouse is irritable, it might actually be you. But memory loss, I forgot, honey. Muscle contraction, pancreatic damage, profuse perspiration. So, there's a lot of good things that's in the multi-element buffered C. And then you have potassium. Potassium can help prevent stroke, aids in proper muscle contraction, works with sodium for the body's water balance, so to speak. It's a significant factor in the development of high blood pressure if it's missing. Now, you got to be careful with potassium. For God's sake, don't take too much because that can be dangerous. So, the multi-element buffered C is the simple place to start. I love the Enviro Detox, which I tell people, take that at night because you've got to do two things. One, you got to clean out. Two, you got to build. So you want to take some of these things at slightly different times. And the Immunocomplete is good. The Immune Essentials, well, I think I'm going to die of old age with a smile on my face, but we'll see.
Because they say this long haul problem is clearly a GI syndrome issue as well. So that's why you're saying the Enviro Detox, right, where you help pull off some of those toxins.
I'm glad you mentioned GI, and this is not planned. Janet and I have different notes, and we don't know where we're going. We kind of think that adds to the excitement of doing this, but it has a lot to do with inflammation in intestines. Inflammation, creates leakiness, which includes diverticulosis, but it can be a lot of other things. I've talked about I can't pronounce it.
Oh, one word you can't say. I've never known you to not be able to do that.
I can't say Nicaragua either. The Nobel Prize in Medicine was 1908 for work in probiotics, and we're still not practicing that over 100 years later. There's about 10 times more microbiotics or probiotics or microorganisms than our cells in our body. So it's very, very good. Inflammation and GI always go together, and that's always a common factor. I don't give a flying flip what you've got. Your intestines and inflammation are part of the equation. The intestines can actually affect gene expression. So think flora, more flora, good probiotics.
And one thing I wanted to mention on that multi-element buffered C, that is one product I've heard several people tell me they've gotten their taste back from taking.
Smell and taste. When just zinc wouldn't do it. Because it's, I shouldn't say never, but it's usually not that simple.
Right.
That's why we do the lab work. And some of the things about getting healthy would include weight loss. You've heard me talk about 40% of us are obese, and a total of 72% of the American population are overweight.
We're going to get to that exciting feature at the end. We have something about weight loss at the end. But I also want to ask you about a new blood test that you've added on. It's on the men's panels, specifically because men have an issue more so with this, but a lot of people have probably never heard of this test. It's called a D-dimer test, and since we've had this long haul syndrome come out, that test has been a very important lab panel that needs to be added on, especially if you have these symptoms. And women, you can do it on you too. If you have those symptoms, we can add it, but can you tell us what it is, why you would need to know about that?
Yeah, well, let me back up. I can't say it simply. So we made an executive decision to add that to the Comprehensive Plus Male Hormones and the Super Panel for men, because we have a little bit more of a tendency to have the pulmonary embolisms, the strokes, the heart attacks, and all that. And we decided to add the thyroid antiglobulin antibodies and the TPO to the women's because they have a little bit more tendency to have a thyroid autoimmune disease. And Janet, through her incredible negotiation, I don't know how in the heck she pulled it off, she got the lab to add those tests, and we didn't go up on the price because they came down. One of them used to be $140 just in and of itself, and she negotiated, and I said, how did you do that? And she looks at me with that little sparkle in her eye and says, you didn't have a chance, so just trust me. And I do.
God is good. He helps us at every chance we get, and everybody out there that listens to us.
Yeah, because we ask him
to
help. The D-dimer, and I've heard it pronounced dimmer, but I think dimers, it's a protein fragment. It's found in the blood once a clot becomes degraded, and that can help in the assessment of thrombosis. That's why I told that one guy, I said, man, you need to go back to your doctor. I'm sorry they're not paying attention to you, but you need to demand that, because his D-dimer was like, holy Jesus, sky high. And, he went and got medical care. Again, we work with the body's innate ability to heal itself, and we work with the medical profession.
Which if that comes back high at the doctor, many times they're just told to take an aspirin. Can you explain if you've got anything different, if you think that's what you'd use on somebody as an aspirin, or could you tell us about anything you may have different beside an aspirin, or what makes aspirin work? I always think the story is great about what does make aspirin work.
Yeah, well,
I just like going down all these rabbit holes.
Yeah, I'm not sure we have time for all that.
But, well, basically.
Now me, if I had a high D-dimer, and I don't, but I take these two things anyway. I take the vitamin E, and I take the nattokinase, and nattokinase is a pretty serious enzyme used to support normal blood flow, circulation, and blood pressure levels. For example, that was the one we told you about, our 71-year-old patient. They said, well, you're about 3% away from having to put stents in your carotid artery because it's so plaqued up. And I put him on natto and vitamin E, and the D with the vitamin K, the magic number is 180 micrograms or above.
Oh, and we have a new vitamin D now also for you out there that are taking two of the 5,000. Right. We now have one called D3K2 Max. So we don't have a picture yet, but we have the product.
So that's 10,000 D plus the magical 180 micrograms of vitamin K. But anyway, this guy took his stuff the E, the nattokinase, and the proper amount of K. And a year or so later, he has zero plaquing, and he's 70 or 71. Of course, he takes a lot of stuff, and he's super healthy. He acts like he's more like 40. But, the D-dimer is very indicative. If it goes high, you have the possibility or maybe
possibility of blood clots.
Yeah, see, I can't say that.
It's a protein fragment produced by the body when a blood clot dissolves.
Yeah, well, it can indicate the possibility of intravascular coagulation, pulmonary embolism that I mentioned, deep vein thrombosis, trauma, bleeding, pregnancy, it goes high there, liver disease, inflammation, and chronic hypercoagulation, which means more than what you should. Now, I do the natto, I do the vitamin E. I do not make medical decisions, so I'll never take I don't give advice about medicines, but I can show you research that says aspirin doubles your risk of stroke, and there was 85 different studies that said aspirin did nothing for heart health, and then Bayer, in their infinite
wisdom,
that goes back to BS, but belief systems. They added a little bit, I think it's 15 milligrams of magnesium oxide, and magnesium is so needed for heart health that even the oxide, which is not a good form, made the heart and work better, even with a bad magnesium. And so because of that one study, that it was actually the magnesium that helped cardiac function, now they're selling 1 billion a day, or whatever they sell, 1 billion, 2, 3 billion aspirin a day. Now, would I take it? No.
And we're not telling you to not take it.
No.
If your doctor's told you to take it, by all means, you do what your doctor tells you. We're just telling you the history of aspirin and how it got there.
But I read research, and I have a good memory, and yes, I take stuff for my memory, and it makes a huge difference when I take it versus not taking it. And I read probably, 1,000 research articles a year. I'm making that number up, but I usually read 50 to 75 books a year. And not all books are good. Some of the books that I've read are like total horse manure.
And I would like to say that if you guys are having problems out there finding a doctor that will help you with these long-haul symptoms, that they look at you like you're crazy, there is a group of doctors across the country called the Frontline Doctors. They won't look at you like you're crazy. You can look them up online. They don't follow
standard of care. They actually practice. And again, I'm not an MD, so that's just what I would
MDs.
Do. Yeah.
They are MDs, and they're a group of them that are trying to help people be healthy. So
they'll think outside the box and work with functional medicine doctors like what we do.
Yes, so look them up. They may be an answer to someone's prayers out there. I also want to mention Dr. Lewis, I can't tell you the number of times we've had people call here, or they'll ask Dr. Lewis, what do I eat? We'll do lab work on them. We give them some supplements. Dr. Lewis loves to read, and so he always recommends a book to them. Well, there's a lot of people that don't like to read. They want the shortcut. They want hand-holding.
Thank Trish from Pennsylvania. I love you. Just call me and tell me you're still around.
and it's they don't know what to eat. They may eat something bad one day. They don't know if it's good or bad. They're going to a reunion. They want to know what they can have. And frankly, with what we have going here is enough to keep us busy enough. Too busy that we want to be able to give everybody the care they need. And Dr. Lewis is not able to just handhold like that. But what he has decided to do is,
through careful consideration and research out the rear, just finding the different programs and finding the absolute best for the money.
We are adding in a integrative nutrition concierge team to our staff. And what that will allow you to do over the next few weeks, you'll start noticing it on the website. It will offer you 30-day programs to work with our functional medicine registered dietitian and certified nutrition coach via weekly phone calls and in-app messaging through our new program by Nutrivo Body. So you will start seeing that show up on the website. We've selected about right now about 4 different programs. One's for, and it's not a diet plan. It's a nutrient-based meal plan. So we're not taking anything away from you, but we're actually going to be adding in the nutrients that Dr. Lewis is giving you through supplements with blood work and combining those together so that you're actually eating the things of some of the products that he's been giving you. So it's a complete.
It's a win-win. 1 + 1 = 3 because synergistically they're going to work together very, very well. For those of you that have wanted to lose weight, and even a few that wanted to gain weight.
There's one that's going to be called one for weight. There's one for thyroid. There's one for energy. And I can't remember what the other one is, but we've got 4.
And memory loss may be a symptom of what we're talking about.
But they'll be on the site. Like I said, they're 30-day programs. They're reasonably priced. You're going to be able to just take pictures of all your food and just send it instantly. Yeah,
they make it easy for you. You don't have to journal it. Just take a picture and send it. There's a lot of communication going on.
And I think we're going to put one of them on sale for a limited time, too, to just let people dip their toe in the water. So stay tuned for that. And we've come to the end of our show again. I can't believe it. Hopefully you've learned something today with us dancing around subject matter. I hope that you got out of it what you've been asking us. And if we can help you anyway, sometimes just pick up the phone and call us because it may be easier than emailing or you can now if you're in our Healthy app. If you've downloaded the Healthy app, and all the people out there that don't know what I'm talking about, if you've been a patient of ours, you are in our new program called Healthy. It's where we share our lab documents with you now, and we also share any kind of nutritional programs Dr. Lewis is giving you. But there's also in-app messaging, so you're able to speak to Dr. Lewis, leave him a message. He'll chat back with you because some people are saying, I wrote you an email, you never responded to my email. He does actually respond. We had a problem with our email at one point, and some of that was going in spam for people, so they thought he wasn't answering. He's actually answering till 8, 9, 10 o'clock at night on the couch because I watch him do it. So we moved to this app to kind of keep it all inclusive, and that way we can keep up with everybody's conversation a bit better. It's Healthy, Healthie. If you have been a patient of ours, all you have to do is change your password. You're in, and then you'll be able to talk to him also. New ones that's how we'll be processing our lab orders from now on, so you might as well get it now. Dr. Lewis, would you like to leave us with closing words, or maybe help people go to the website and tell them how to get started if they've not done lab?
Yeah, I always tell Janet, thanks for helping me be technologically more competent. Thanks for dragging me into the 20th century. She said, Stephen, it's the 21st. Go to Green Wisdom Health and look it over. And what I'd like to tell you is difficult roads often lead to beautiful destinations. Don't quit. And in the happy moment, we should praise God. In difficult moments, we should seek God. In the quiet moments, we should worship God. And in every moment, we should thank God.
I like that. And like he said, go to greenwisdomhealth.com, click on the health survey, get started. If you don't know what lab panels are best for you, it will actually recommend the lab panel that it decides is best for you based on what you fill out. And we appreciate you listening to our show. We hope you stay healthy. And we'll be here next time on the Green Wisdom Health Show.
Once again, our show has come to an end, but your hope in your health is only beginning. If you or a loved one are in need of a different outcome and are waiting for a brighter future, take the first step and go to our website and fill out the health survey. Please don't keep us a secret. If you know someone that could benefit from this podcast, please share this show with your friends and family. You are only one step away from a life worth living.